Welcome to Surface Cosmetic Anti-Aging Clinic, the home of the facelift without surgery. My name is Dr. Alex de Souza. I'm the medical director. Here at Surface, we use a combination of beauty and health together with treatments to focus on comfort, safety, and no downtime, to allow you to have a facelift without surgery. Now, allow me to show you some of the packages and procedures that we perform right here at Surface. The combination of lift, tighten, and repair associated to other procedures such as Botox and fillers allow us to present to the patient a result very similar to the traditional facelift but without surgery. This is before and after. You can see here the patient really gained youth and beauty. You probably heard about radiofrequency treatment and you ask if this is the plastic surgery without surgery. We believe that radiofrequency is a fantastic treatment. It's in magazines, TV, it's everywhere. But the best results with the radiofrequency is when you associate it to the lift and other procedures such as Tesla and skin restoration. Join us and learn how can you make your results of radiofrequency better right here in Surface. Would you like to know what Tesla is? Tesla is a new technology being used for the first time in cosmetic medicine right here in Surface. Our intention is to remove the water, just like in this balloon. This is an empty balloon. This is a balloon of water. Notice that the balloon increases in size and shape. Once we remove the water, you can see the balloon collapse again, reducing the size. And that could happen in your belly, in your thighs, in your arms, on your face. It's a new way to do a new shape on your body without pain, without surgery, in no downtime. You probably heard about skin conditioning, skin moisturizer. Have you heard about skin fitness? That's a new program to remove the old, bring the new, control the inflammation, oxidation in your skin. For that, we have our line Souza, Skin Enhancement Delivery Assistance, which is a line developed to restore your skin and your beauty in a fashion that you've never seen before. Skin does not need a moisturizer. Skin needs nutrition, exfoliation, and protection. That's Souza. You can find right here. Join us and learn more about our skin fitness program. Now you know what is the plastic surgery of the 21st century. Beauty and health, always together. That's why anti-aging is so important. That's what we call the plastic surgery for inside out. And for the plastic surgery without surgery, would you like to learn more? Come with me, let's see a video about the facelift without surgery. This procedure was developed to be able to restore the beauty and the health without the inconvenience of surgery. The recovery time for this is no longer measured in months or weeks, not even in days. The new recovery time is measured in hours. The patient wants to drive to the office, drive in and out, and look 10 years young. Here you can see how the program works. The patient arrives in the office, and because there's no anesthesia, the patient can drink something, it's comfortable, relax. They don't have that hospital environment. It's a very relaxed atmosphere. Then we move to the next step, which is the pre-op pictures. I think that's very important, and we should always have the pictures before and after, because the patient tends to forget the way she looks after the surgery. So it's a nice way to monitorize the way things are going. And of course, since that is done, we move the patient for a marks. The demarcation is important because we don't cut any hair, so we do a special hair dressing on it and then mark the points. Very important to start marking the vectors, where you're going to lift the skin, and also you need to identify the insertion of the temporalis muscle. And for that, we ask the patient to chew. Once the patient chews, we can identify exactly where the temporalis muscle attached to the bone. Therefore, at that point is point A. And then you move to the point B, which is on the hairline, and the point C and D, as you see on the video. Point A, B, C, and D, then will be the guide for our procedure. Once we have that area marked, we come with anesthesia. Once again, because there's no cuts, no stitches, the anesthesia is very simple. We only use local anesthesia. We use lidocaine at 2% with epinephrine. About 6 to 9 mL are plenty to anesthetize both sides. It depends on the patient. And once that is done, we start the procedure. The instruments are very simple. We use a special needle that carries our thread. We use a needle holder to hold that special needle. We have a special hook, looks like a nerve hook. We also have the probes that can make the track where the thread will go through. And we also have some of the traditional instruments like scissors, a small mosquito forceps, sometimes is necessary to open the hole, and a needle, 18 gauge needle, just to make the little hole in the skin. There's no cuts at this point. So once you have your instruments ready and the patient with anesthesia, then we start the procedure. We start the procedure at point A, where with a small 18 gauge needle, we can make a small hole, and through that hole we can put a series of probes. And that probes will place the track. From point A to point B, that's plan 1. Plan 1 is transmuscular. It goes through the muscle to help to support the thread, starts at a deep level and moves to superficial level and exits at point B. From point B to point